Our final case study 4, we will be evaluating Teresa's lifestyle behaviors and offer sound advice towards self-improvement in all aspects of her health. I am Grant Forbes and I will be presenting Group 3's assessment of Teresa's lifestyle. The other members of Group 3 who contributed to this case study are Linda Cruz, Jamie Fajardo, Crystal Gonzalez, and Luis Navarro. According to the Centers for Disease Control and Prevention, Ms. Jenkins is considered to be overweight. A normal weight for her stature of 5 foot 4 inches ranges from 108 to 145 pounds. Due to her weight and racial background of being half Latina and half African American, she has the greater risk of developing chronic conditions such as high blood pressure, high cholesterol, and diabetes. Even if she only lost a few pounds, it can help lower her risk of developing these chronic diseases. But it is also important to note her age. Teresa, being 78 years old, her body's ability to combat these serious illnesses are limited. We will dive deeper into how we can help Teresa prevent getting these in the slides to come. According to a recent 24-hour intake analysis, Teresa experiences deficiencies in the amount of consumed calories, protein, carbohydrates, percentage of calories originating from carbohydrate consumption, and dietary fiber. Ms. Jenkins does not get enough calories. She consumes 858 calories less than the required amount. As stated in the case study, family members have noticed her lack of eating stemming from the death of her husband, Theodore. He passed away recently due to a stroke. Since his death, Teresa has had a severe loss of appetite, which is a common side effect that comes with the loss of a loved one. As we mentioned earlier, she does need to lose at least 9 pounds in order to reach a healthy BMI. But in this case, she needs to lose that weight in a healthy manner. Starving yourself reaps no benefits for the body, no matter how many pounds a person loses. Malnutrition in the elderly is a very serious condition as it can exhibit poor wound healing and muscle weakness. In combination with poor wound healing, the immune system is also weakened, which then leaves the body vulnerable to infection. In addition, Teresa is deficient in the amount of consumed linoleic acid, alpha-linoleic acid, and calcium. Linoleic and alpha-linoleic acids are two main fatty acids essential in maintaining a healthy diet. These omegas are able to control inflammation in arthritic conditions and protect against neurodegenerative diseases. In this table, it is shown that Teresa experiences deficiencies in the amount of consumed potassium, copper, iron, magnesium, phosphorus, zinc, vitamin A, and vitamin B6. To combat this, she should eat at least 3 servings of fresh fruits and vegetables daily. On the other hand, she consumes sodium and selenium in excess. Instead of relying on canned soup, which is known to have high amounts of sodium content, she can turn to different food options like a kale salad with unseasoned chopped chicken breast or wild-caught salmon. With the salmon option, she also reaps the benefits from its linoleic acid content, which, as we discussed earlier, is what Teresa has been lacking. This goes to show that practicing a well-balanced diet with a variety of different healthy options can cover almost every nutritional requirement with ease. Teresa experiences deficiencies in the amount of consumed vitamin B12, vitamin C, vitamin D, and vitamin E. She consumes in excess of vitamin K, folate, thiamine, riboflavin, niacin, and choline. As mentioned before, a well-balanced diet can effectively control these levels. Something that jumps out at us is her low amount of vitamin C. Vitamin C is vital for a healthy immune system to function. Being 78 years of age, Teresa must do anything and everything she can to strengthen her immune system as it is in a weakened state due to Teresa being depressed and her old age. We reiterate again that she consume more fruits and vegetables in her diet to satisfy her vitamin C requisite in order to strengthen her immune system. Vitamin A maintains bone growth, calcium and phosphorus forms bones, magnesium maintains bone structure, and vitamin D mineralizes bones. Deficiencies in calcium, vitamin A, vitamin D, phosphorus, and magnesium negatively affect bone health. In Teresa's case, her calcium consumption is a major issue. Her calcium intake during the 24-hour intake analysis was a shockingly low 263 milligrams out of the 1,200 milligrams requirement issued by the USDA. According to a study that focused on the effect of regular physical activity on bone mineral density in postmenopausal women over the age of 75, researchers have found that exercise can slow down the aging effects in bones. In addition, although osteoporosis affects both men and women, it is found to be more common in women, affecting postmenopausal women at a rate of 1 in 4. This gives Teresa all the more reason to correct this calcium deficiency as her bone health is weighing in the balance. We suggest that she consume more greens like kale, broccoli, and spinach, but it is also important to mention that calcium is used only when there is enough vitamin D. A deficiency in vitamin D can lead to a condition known as osteomalacia. According to Schultz and others, the condition contributes to low bone matrix mineralization combined with enlarged thickness of osteoid tissue and the presence of chronic and severe vitamin D deficiency. The softening of the bone leaves people, especially the elderly, prone to breaking bones and falling. Due to this risk, it is important that the supporting family keeps Teresa from moving back on her own. Although it will be emotionally painful for Teresa, it will be in her best interest to stay under the supervision of Tyrone and his family. In addition to a faulty immune system, a lack of vitamin C intake can result in scurvy. Scurvy causes weakness throughout the entire body. Although only 20,000 cases are reported in the United States every year, the most prone to this condition are the elderly who have malnutrition habits. It is also possible that Teresa's potassium deficiency could be one of the reasons why she does not eat a lot and is skipping meals. Not consuming enough potassium-rich foods like bananas, beans, dark leafy greens, and yogurt can cause a lowering in appetite, cardiac dysrhythmias, bewilderment, and decreased muscle strength. First developed in 1982, the Geriatric Depression Scale is a 30-item self-report assessment used to identify depression in the elderly. According to the research that focused on the relationship between depression and loneliness in the elderly, it was observed that there was a direct relationship between loneliness and depression in elderly people. Our patient Teresa scored a 27 out of 30 on the assessment. According to the Geriatric Depression Scale, she is suffering from severe depression. Mentioned from the case study, she rarely attends family meals and only goes out to the grocery store to buy her necessities. Her passion for life has clearly faded. It is our job as nurses to offer comfort and caring advice that will benefit not only her, but the rest of her family. Teresa falls under the eighth and final stage of Erikson's theory of psychosocial development. Integrity versus despair is the stage that happens during late adulthood from age 65 through the end of their life. During this time frame, people reflect back on what they have done with their lives and come away with either a sense of fulfillment from a life well lived or a sense of regret over an unsatisfying life. People who recall happy moments and proud achievements have a feeling of integrity with what they have accomplished in their lives. On the other hand, some do not feel content with the life that they led. Those negative thoughts can lead to feelings of their life being a waste as they let life pass them by. Mental health holds just as much importance as physical health, as the brain controls the body's functions. If the brain is not content, the body will react in a negative way and will not lead to a desired lifestyle for anyone. As mentioned before, those who have lost their spouse or did not achieve what they wanted in their lifetime are often left in a severe depression like our patient Teresa. It is difficult, but we suggest that she resume her past activities that gave her joy, like going to the hairdresser and shopping. Although her husband will no longer accompany her, she can bring along a grandchild to brighten her day. It is important that Teresa comes to peace with her grief so that her body can recover and enjoy the final part of her life with her grandkids and family by her side. It is vital that we advise Tyrone and the family that they need to make sure that Teresa is eating 3 complete nutritious meals every day. Her body is drained emotionally from the trauma of losing her husband and physically with her malnutrition. It is equally important to encourage daily exercise. The exercising does not have to be complex. A simple walk around the neighborhood every day will do its part in preventing blood clots from forming. The elderly are already at a greater risk of developing blood clots, and Teresa's inactivity makes her more likely to face fatal problems such as a pulmonary embolism. And finally, to restore her happiness, Teresa needs to go back to doing the activities she loved before her husband's death. As we stated earlier, it will be emotionally tough at first, but having grandchildren to help lift her spirits up will help with both her mental status and physical well-being. If she follows our suggestions, she will prosper and finish her life with integrity and increased longevity.